How does the detrusor muscle affect OAB symptoms? Have you ever wondered how the detrusor muscle impacts symptoms of overactive bladder? The detrusor muscle is a smooth muscle layer in the bladder, while that plays a crucial role in bladder function. Overactive bladder, or OAB, is marked by symptoms like urinary urgency, frequent urination, and sometimes even urge incontinence. These symptoms are often linked to involuntary contractions of the detrusor muscle, a condition known as detrusor overactivity. In a healthy bladder, the detrusor muscle remains relaxed while the bladder fills with urine. It only contracts when it is time to urinate. However, in individuals with OAB, this muscle can contract unexpectedly during the filling phase. This leads to a sudden and intense urge to urinate, along with an increased need to go to the bathroom more often. Several changes in the detrusor muscle contribute to these OAB symptoms. First, studies have shown that the detrusor muscle in unstable bladders often has enhanced spontaneous contractile activity. This means it can trigger urgency and even urge incontinence more easily. Additionally, the electrical properties of the detrusor muscle may change in OAB. Increased electrical coupling between muscle cells can lead to contractions spreading more easily throughout the muscle. This can further exacerbate the feeling of urgency. Morphological changes also play a role. The detrusor muscle may experience patchy denervation, which is a loss of nerve supply and infiltration by connective tissue. These changes can cause the muscle to enlarge and behave differently than it should. Neuroplasticity is another factor to consider. Changes in nerve growth factors and receptors in the bladder can heighten bladder sensation. This means that the bladder may signal the need to urinate even when it is not full, leading to those involuntary contractions. Moreover, reduced blood flow and inflammation can contribute to detrusor muscle dysfunction. Poor blood flow can impair the muscle's ability to function properly, leading to more OAB symptoms. When it comes to treatment, medications like beta-3 adrenergic agonists can help. These medications work by relaxing the detrusor muscle, which can increase bladder capacity and reduce the urgency and frequency of urination. It's important to note that while OAB symptoms stem from detrusor muscle dysfunction, they can sometimes be confused with symptoms from other bladder conditions, including bladder cancer. While OAB primarily involves functional changes in the detrusor muscle, bladder cancer may cause irritative symptoms through different mechanisms, such as tumor invasion or inflammation. In summary, the detrusor muscle significantly affects OAB symptoms by exhibiting abnormal contractions and altered responsiveness. Understanding these changes is vital for diagnosing and treating OAB effectively, while also distinguishing these symptoms from those caused by other bladder conditions. If you are experiencing symptoms of OAB, it is always best to consult a healthcare professional for personalized advice and treatment options.